If you call our family, the Medicare family, for advice, for a consultation because you're getting ready to go on Medicare and you want to know what it's going to cost, or people on any of my live social media videos, they're like, hey, I'm in Ohio. How much does it cost? Well, I need to know what county, what zip code you are in Ohio before we can talk to you about price. Why does my zip code matter? Because Medicare insurance plans, Medicare supplement plans, private Medicare Advantage plans, and Part D drug plans are priced all the way down to your zip code. In your zip code, the plan could be very, very good, attractive. And then right across the street, your sister lives right across the street and that's a different zip code. She might not even have a plan available. The insurance company doesn't have to file it in every county. And if she does have a plan, it might be really expensive because she's in a different zip code. They're for profit. And they have all the data based on all the zip codes and how sick people are in each zip code, and that's how they price their plans to make the most money. Okay, I'm sure I got your attention there. That always makes people mad. But if you're getting ready to move from one zip code to another, then you need to know it could go up if you're moving to New York and you have a Medicare supplement, it could double. Or it could go down if you're moving from New York to Florida, it could be cut in half. Or if you're moving from Tennessee to Florida, it could go up. So it's all based on where you're starting at and where you're ending. You could have good news or you could have bad news. And the laws differ very much from state to state. Now, we have federal Medicare laws. That's the same wherever you live. Then we have state insurance laws that are crazy different. And if, like I said, if you live in California, Oregon, you have a birthday rule. I have another video on birthday rules where you might be able to move your plan just because it's your birthday. Or in Missouri, you can move your plan even if you're sick. You can change your Medicare supplement plan just because it's the anniversary of when you bought your Medicare supplement plan. It's the only state with that rule. The rules are crazy all over the country, so it very much matters where you live, what the rules will be. How about snowbirds? And you guys are terrible. You snowbirds, you call us and you try to ask us where you're a resident. You say, I spend half the year in Connecticut and I spend half the year in Arizona. Okay, I need to know where you're a resident. Where is your home record of legal residence with Social Security and Medicare? Okay, so I don't care what you tell the IRS. What did you tell Medicare? What did you update with socialsecurity.gov? And you're like, well, I filed taxes in Florida, but I own a house and I vote in Connecticut, and I don't want to get into it. It's not simple to determine. It can go either way. If you're spending 6 months in each place, you have to declare what's your state of residence. So if you're a snowbird and you declare that you're a resident of Florida, we have to base the rates that we quote you for your Medicare supplement insurance, your Medicare Advantage plans, your Part D drug plans on your zip code in Florida. Now, the fact that you already told us you spent half the year in Connecticut, will it greatly impact what we recommend to you, since we don't want you out of network or potentially having no coverage when you go home 6 months to Connecticut. So when we ask people about what zip code do you live in or their county, most people universally seem kind of irritated. Like, what does that matter? It matters. It matters a lot. So if you're getting ready to go on Medicare, first stop, say you're turning 64. You haven't yet gone on it. Go to our website, themedicarefamily.com. Go watch my Medicare workshop. It's only 15, 20 minutes. But it'll answer a lot of your questions to get you ready on this journey to get ready for Medicare. When you're ready, book an appointment on our website. We're here to help. Licensed in all 50 states. We represent over 62 different insurance companies. We're independent contractors, so you don't pay for our services. If you like this video, you might really like this video. Check it out. And we'd appreciate if you subscribe to our channel so you never miss a great video. We put out one every week. Check in the description below this video for a link to our cheat sheet on Social Security and Medicare. And you can also give us a comment if you have a specific question. Always feel free to call us or email us at the Medicare Family.